Hi, this is Dr. Sal, and this is New Arch by Dr. Sal. We help our patients with who don't have any hope with their teeth or who have been using dentures for a long time to get back to life and be able to chew and smile and function. So in today's video, I want to talk about a topic, and we often get this question in our consults. And the topic is, are my implant teeth going to look fake? So first question, do dental implant teeth look real or fake, all on 4, all on 6 type of solutions? Well, the answer is, it depends. They could look extremely fake, or they could look extremely natural. So I guess that would be a expected answer. And let me just go into this a little bit. So the answer to this question is it really depends on how the teeth are made. So there are a couple of different choices when it comes to teeth with restoring the implants. So in other words, making the bridge. One is like a plastic base, acrylic base. It's called PMMA type of solution, or sometimes acrylic is used. And the other one is zirconia. We mostly work with zirconia. There are times that we will use PMMA on titanium bar, and both can look very, very natural, but it's all in the planning. So when patients present to us and they want to do this treatment, first thing we would do is to take a photo of their face. And many times we find that patients are pretty reserved. They don't want to smile. They don't want to show, what they're hiding. And we try to warm up the environment, and we really need that big smile, because that really is going to reveal how natural their outcome is going to be, because it has so much to do with the planning. So we explain to them the benefit of why they should give us a exaggerated big smile, and they do. And once we obtain that, then we will, with our design software, we will try teeth on top of what's existing. And what's existing could be, it could be a wreck. It could be just not something desirable looking, but it still may give us some ideas. And what we do is, with our sophisticated software, we put the ideal set of teeth on top of what's existing. Obviously, this is on a computer screen. And we start planning. We start to see how it would look, how the smile line should be, how the curves should be. There's so many things that go into this. We have a really great team here, and they're very passionate about this. They want this to look. They want the teeth to look right. So we start planning our process, and when we are happy with it, we arrive at a point when each of us take a look at it to see how things are looking from on the computer, and we continue the process from that point. We do ask for photos of our patients, if they're good quality photos especially, to give us a sense of what their teeth look like in the past, perhaps when they were proud to smile and show their teeth. So those are very useful information. Some people don't really, they don't want that, but they will tell us what they want. So we try to make sure the communication is clear so that we can understand what is it that they're looking for, and we can achieve that for them. Another question is, can you tell the difference between dental implant teeth and real teeth? So again, this is kind of like the first question. It depends on the planning. It depends on a lot of different factors, but I will tell you, many of our results, I want to say all of them, but our patients only receive compliments, and there are times that we feel like we should tone things down a little bit, because maybe it's given a little glimpse of, not real. So if that's the desire of our patients, we tone things down and make things look really natural. But I guess to make the long story short, the types of things that are necessary to make teeth look very natural in terms of all on 4, all on 6 type of bridge work, there are some factors. Okay, so factor number 1, if we're using zirconia, we want to use the type of zirconia that's going to be tooth-like. So there is zirconia is an earth material, and it comes in a white puck. It's a, you wouldn't really think of it as, oh, is this going to be teeth? Yes. And it's a very interesting process. And the way it works is, so think about having a cup of milk and a cup of water equal. Now, the milk should signify strength, while the water signifies transparency. So you're going to make a mix out of this, and it's going to give you the translucency or the ability of the zirconia to pass light versus strength. If you don't put any water and just use milk, well, it's going to be very strong. It could be very white, but it could also look very dead. It could look very fake. And if it's just water, obviously that's not going to withstand forces, and it's not going to be strong enough for the final for the bridge. So it's a unique combination of the two. We have used very successfully some excellent materials which give us both. Now, it doesn't end there, because from that point on we need to put artistic touches, and we need to color the gums if the gums are going to be visible, and we have some very advanced technology products that allow us to do this. And the color of these materials, they stay, so they don't discolor. They look very real. They look like they're real gums. Now that's actually another point I would like to raise. In the beginning, the last question I was talking about the photo process. So with the all-on-4 or all-on-X, what could cause a disaster, and a real disaster, is if the bottom of the bridge would be visible when somebody smiles big, because it's a clear transition line. And when somebody smiles, if their lip is going so far up and it's not able to hide this connection line, it's a problem. So that's the reason for the big smile or exaggerated smile we try to get, because that really has to do with our planning. It's very important. So the type of the zirconia materials, very important, very good quality, strong yet aesthetic materials. The artistic abilities of the team to give subtle changes and effects on the teeth. All of these come together and they just give us excellent results. So one question I got recently was that I think somebody it was a consult, and somebody saw another friend or somebody they met, and then they thought they could tell that it was like an all-on-4, all-on-X type of thing, and because the gums look extremely fake. So again, that's a good observation, and it shouldn't be like that. And there's a balance of different colors. Like everybody, if I looked at 10 different people, all of them will have different color gums. They might be similar, but there's going to be difference with different people. So it's important to understand the gum color and the texture. So the gum is not like teeth. It should have a texture, but it shouldn't scream. It shouldn't be a very bright color. And it should kind of like blend in, and it should look real. And light shouldn't reflect from it, because then it starts to become not like gum tissue. And I have observed all this and certainly learned so much from it. So our technique that we've developed has to do with creating a texture, almost like a real gum tissue type of thing. If you run your finger over your gums, you'll feel like it's the skin of the orange. It's very similar to that. So the gums should feel like that, or they should look like that on the bridge. Another question we get is that, do I get to decide on the shape and color of the teeth? And the answer is absolutely. This is a mutual process. We like to involve our patients if certainly they like to be involved. So we ask clear questions. So clear question would be, can you show me a photograph? Or like, we want to get from them or from you, like what exactly it is in your mind. And to be frank, to see if it's realistic, because that's another thing. There's a lot of abilities that is applicable to all this type of treatment. So you can do a lot. You can change a lot if you wanted to, but not all changes may look good. So we have a heart-to-heart conversation of what we think is going to work out the best, and so we come to an agreement with our patients, and we like to make certain there's no surprises, and they're happy with the look of their teeth. Thank you for watching the video. We really appreciate questions. Would love to answer questions if you have any. Please submit them to our website, and we'll get to them for sure. And if you're nearby, we're always happy to meet with candidates. For the lease, you will be well educated, so we can think what would work best for you. And thank you for watching. This is a big deal. This is a big important decision. So do it once and do it right. And we're here to serve you at New Arch Dental Implants. New Arch by Dr. Sell.